Hi there, welcome to another episode of Time with Dr. Adams. Today we want to talk about the importance of ANC. ANC is Antenatal Clinic. It's a special consultation between pregnant women and their doctors or midwives. Previously we used to use a green book, but now this is the book we are using, Maternal Health Records. And there is another one that is 2-in-1, that is the Maternal Health Records and that of the baby. So when you open this book, the starting is maternal record. Maternal record, we have name, age, address, educational status, street name, location, telephone number, occupation. Are you single? Are you married? Name of husband, partner, occupation of husband, next of kin, relationship to next of kin, address, home address, street name and location. Why do we need all these things? Because sometimes we have pregnant women coming to ANC and suddenly they collapse. Who are we going to ask these questions? How do we know where she is from? We pick this book, we have your husband's name and your next of kin's name. So we can call any of them and tell them. Or we have pregnant women coming to ANC and suddenly they go into labor. We need to call someone and let them know of this incident. We also have a hospital number, the date of your first service. We have major risk factors like previous CS, previous PPH and so on. Menstrual history. In my other video, I spoke of the importance of you knowing your menstrual history. Here we have it. Duration of your menses, the number of days between your menses, last menstrual period, and so on. Then we come to obstetric history. Please, when it comes to this, do not lie to us. There is a reason why we need to know your obstetric history. For instance, if we ask you, have you miscarried a baby before? Have you had an abortion before? We do not want to judge you. However, it gives us your history and we will know how to deal with you. For example, if a woman has had 5 babies, and I'm comparing a woman who has had 5 babies to a woman who is in her first pregnancy, I know how to treat them. Even in labor, there's a medication I will want to give to the fresh mother in labor that I will not give to the person who's giving birth 5 times. I know the side effects of these medications. So when we ask you these things, it's not to judge you or it's not to go more into your private life or anything. We just want to give you the best of care. Now, when you turn, we have breastfeeding history. There are sets of questions here as well. Then we come to the medical and surgical history. Hypertension, heart disease, sickle cell, jaundice, and the rest. Please do tell the truth. It's all to help us. If a woman is in labor and epilepsy is checked, yes. Epilepsy is checked, yes. I know what to expect and I know what kind of medications I should have in my emergency box. We have family history. In your families, does anyone have hypertension, diabetes, heart disease, and so on? Drug history. Do you react to any medication? Allergies, food. Do you react to anything? We need to know all this. Contraceptive history. Were you on any contraceptives? Now we come to the history of sexually transmitted infections. Believe you me, this thing is very important. If we know your sexually transmitted infection, we know how to handle you. Then again, we know how to protect ourselves and to handle you. We know what to expect when you give birth to the baby and the first aid to give to the baby. Then we come to the physical examination. That's your doctor or your midwife will examine you and write it down. Then we come to investigations. Investigations, we have hemoglobin, and then we have the dates here as well. We have repeat hemoglobin, and then we repeat it as well. So at least every month, at least every 3 months, you should check your hemoglobin, or depending on what your doctor wants to do, because sometimes we want to monitor your hemoglobin. You can do it as much as you want, but at least you should have 3 times you've checked your hemoglobin level. First trimester, second trimester, and third trimester. We have antibody screening. You can see VDRL. So I'll just explain it to you. The first one is syphilis. We have HBsAg, and that's hepatitis, and then HIV test. With all these, when you do, we write it down and then we write the date against it. HIV test is repeated again. You do stool ARI, urine ARI. We want to know whether whilst you are pregnant, you had an infection. Urine ARI. It's very important because most women when pregnant get a lot of UTIs. And then we have other investigations like ultrasound. ultrasound is very important because we want to know what is happening with the baby. We have this number of weeks that we expect to see the baby's limbs. We have this number of weeks we expect to see the baby's spine visibly. We have this number of weeks we expect to see the baby's genitalia. Now, if we don't do this ultrasound, we wouldn't know if something abnormal is happening in you. If we don't do this ultrasound, we wouldn't know whether your baby is growing well or not. We have a condition that we call intrauterine growth restriction. That means your baby is not growing as we expect. But when we do this ultrasound, that's when you know. So that's an ultrasound. We expect you to have a minimum of 3 ultrasounds. First trimester, second trimester, and third trimester. So that when there's an issue, you'll be able to pick it up fast. We also have topics for individual client education. You are supposed to talk it over with your midwife and your doctor. See, there's a part that says the husband should be here. The father is supposed to come along to ANC. I know that sometimes the husbands are busy, but please find time to go to ANC with your wife because this baby belongs to you and your wife. So there are a couple of questions here, topics that you can go through with your midwife or doctor. And then we come to this one, very important. Date, weight, BP, urine, protein, sugar, gestational age in weeks, fundal height, the present, the descent, FH, supply of folic acid and iron supply, complaints and treatment, then the name of the doctor or the signature. This is very important because if there's anything happening, we'll be able to tell. So for instance, if you come and your sugar level in your urine is high, we know that there's something called gestational diabetes, so that we pick this thing up early and start treatment. If you come and your BP is high, we know what to do because we have something we call hypertension in pregnancy. You might not be a previous hypertensive patient. However, when you got pregnant, you realized that your BP was going high. With this, we know how to treat you. We have insecticide net, yes. They will write when it was given and then the date. We have malaria medication we will take whether we gave it to you or not. We have tetanus injection here. This is all very important to us. I know what to do to a mother who did not receive tetanus injection, and I know what to do with the one that received. So please, these and more are the reasons why we need you to be coming to the antenatal clinic, because when we pick up a problem, we'll be able to treat you very early. When they get to labor, there's nothing, there's no record. Now when we pick the book, we don't know what happened. We've had situations where a woman will walk into the labor ward and then will be seizuring, will be having a seizure. But if you had attended antenatal clinic and we opened and we saw that, oh, you had hypertension whilst you were pregnant, it gives us an idea of what is happening. So please and please and please, dear fathers, encourage your wives, your mothers, the mothers of your babies to attend antenatal clinic, and do not let them go alone. Go with them, because we also know that you have a question. Like, subscribe, and share. You can leave your comments below. Any question, like I said, if you have any topic you want me to discuss, kindly let me know. Thank you.